This procedure is done for people who want to lose those extra 40, 60 pounds that they've been trying to lose for a while. It gives them the kickstart they need to sort of jumpstart their life.
Endoscopic sleeve gastroplasty is a very interesting procedure for people that couldn't be offered the sleeve gastroplasty before. Some people have major scarring of the abdomen, preventing any laparoscopic approach. Some people have a very bad heart, or some people are extremely obese. They finally have now an option to receive the procedure completely from the inside.
Basically, we constrict the stomach to make it the size of a sleeve. So it's similar to surgery, but we just do everything through the stomach in a non-invasive manner. This procedure can be reversed, repeated, and done as many times to fit the patient's needs. We sort of say that it's similar to doing orthodontics, where you need to tighten braces every once in a while.
We have converted a very complex procedure that used to be done surgically to an outpatient procedures that can be done in a few hours, with the patient going back home the same day.
What is the disease of obesity? It's a signaling problem between fat cells, stomach, intestine, and the rest of the brain. The brain can't tell how much food has come in, how much fat is stored. And that's why it's hard for people to lose weight.
This procedure has only been done in very few centers in the United States. The major one has been the Mayo Clinic. In New York, we really now are taking this program to the next level by offering this procedure to all the patients that cannot have any laparoscopic approach.
The endoscopic sleeve gastroplasty procedure constricts the stomach without any surgery. The patient's asleep, the endoscope is advanced through the esophagus into the stomach. You perform the sleeve by doing a set of 6 sutures, and then you bring the sutures together by tightening it. So it's similar to an accordion that's being closed down. That's what the stomach does. So you bring everything together, and that closes down the stomach quite nicely. You repeat this process several times from the bottom end of the stomach to the top end. That way you form a really nice sleeve. Afterwards, the patient goes to the recovery room and probably stays there for between 2 to 3 hours. They recover and go home. After the procedure, you're unable to eat as much as you can, so that plus diet and exercise gives you the ability to lose weight.
Extremely important for the patient to follow up as an outpatient with the endocrine doctor that will tailor all his metabolic parameters.
We manage their diet, we manage their medical regimen, and in some cases we find that as time goes on we can adjust their medical regimen or add other medicines that can help them to get the best possible result.
It is very important for the patient to be incorporated into a program where he will meet an endocrinologist, a program where he will meet a nutritionist.
Between the endoscopist at the CADC and our obesity medicine specialist and endocrinologist at the Center for Weight Management, we have resources and knowledge that almost no institution in the country has as far as managing obesity and performing this procedure.
We are tailoring the treatment offered to the patient to the type of condition the patient has.
Every patient that we do, we follow them. We follow them with at a period of 1 month, 3 months, 6 months, and a year. So at 3 months, they lost anywhere between 20 to 30% of their extra body weight, and at 6 months, they lose anywhere between 30 to 60% of their extra body weight.
Obesity is a big problem. Obesity leads to diabetes. Obesity leads to heart disease. Obesity leads to knee problem. All those problems can be taken care of if we can just bring the weight down in a very minimally invasive fashion. And this is exactly what endoscopic sleeve gastroplasty offers to those patients, a new hope, a new option.
We've also noticed that it helps improve other aspects of your life. So things like sleep apnea, your HbA1c, which is your diabetes score, your cholesterol, this all improves all these markers.
I'm enthusiastic about the results that we're seeing. The patients are enthusiastic. We've seen very good weight loss, a reduction in appetite, a reduction in thinking about food. And this is very promising.
I want the patient to know what the procedure entails. I want them to know that I'll be with them every step of the way, from day 0 to forever. I want them to know that this is not a miracle cure, but it will help them get there. It will definitely, if they're motivated enough, and I've seen it with so many of my patients, they'll get that weight loss they want.